Hi everyone, I'm going to talk about the development of WASH guidance that are context specific for the control and elimination of cholera. So with the support of the Global Task Force for Cholera Control, countries facing cholera are developing national cholera control plans that include WASH guidance. However, WASH and cholera interventions are not always replicable across different contexts, even in one country, and a guidance on how to choose and implement WASH interventions, depending on the cholera context, is necessary to help develop the NCPs. So for this, we developed a multi-steps method. We convened a working group to collaboratively develop the guidance. We did a literature review, including the WASH guidance in cholera, the NCPs, and a systematic review of publications on WASH and cholera interventions. We also did key informant interviews with the working group members to collect qualitative information on WASH and cholera interventions and cholera context definition. Based on the review, the key informant interviews, and the working group experience, we then developed WASH guidance. So this poster is going to present the results from the literature review and from the key informant interview. For the literature review, 36 manuscripts, 6 guidance documents, and 4 NCPs were reviewed. The peer-reviewed manuscript focused mainly on evaluating the effectiveness of WASH interventions, both in emergency and in context with recurring cholera. The guidance documents focused mainly on outbreak activities, and the NCPs focused on WASH related to the SDGs, with more of a long-term focus and less applicable to outbreaks. Overall, the themes that emerged are that cholera occurs mainly with or directly after another emergency, that case area targeted interventions are effective instead of broad interventions, that collaboration with the health sector is necessary, and that the context needs to be thought of in a broad way that includes many factors such as previous interventions or community attitude. We conducted 18 key informant interviews where 26 themes emerged that are divided into 5 categories. We found that the context can be defined by the objective related to the disease, so either control, prevention, or elimination. There are factors defining the specifics of the local situation that will influence the type of intervention implemented, such as do you have access to the beneficiaries, what are the existing infrastructures, what is the funding available, etc. We identified circumstances that are usually used for context, like development, urban, com settings, etc. They have similar characteristics and are too broad to effectively select appropriate WASH interventions, but they can overlap. Then there are factors influencing the successful implementation of WASH and cholera activities that emerge, such as the collaboration with the health sector, the mapping of cases and targeting of activities, and the monitoring of activities. And the final category is the WASH activities that are implemented for cholera outbreaks, or cholera context. So to select the appropriate WASH and cholera interventions related to the context, the objective related to the disease needs to be defined first. Then the specifics of the local situation will influence the type of interventions and how to implement them. And then the characteristics related to the broader context will help guide the selection of the intervention. In both the literature review and the key informant interviews, we saw similar themes that emerged, like the collaboration with the health sector and the targeted approaches. Thank you for listening, and I will be available if you have any questions.